Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder if your therapy actually works, or if there is a way to make it even better? Well, this new study dives deep into that very question. Imagine going to therapy and your therapist regularly checks in with how you are feeling, not just about your big problems, but about the little things too, like your relationship with your therapist or what you are learning between sessions. That is exactly what this study explored. They looked at a new system called the Greifswald Psychotherapy Navigation System, or GPNS. Basically, it is a way for therapists to keep a close eye on how therapy is progressing using patient feedback. The big question was, does using this system actually lead to better results for people in therapy? So, how did they figure this out? Well, they're in a university outpatient clinic, a place where people go for cognitive behavioral therapy. They looked at over 260 patients. Now, here is where it gets interesting. Therapy is supposed to be helpful, right? But sometimes it is hard to say for sure if a new tool is making a difference. This is especially true when people choose to use the tool or not. To get around this, the researchers used a clever trick called an instrumental variable approach. Think of it like this. They found a natural experiment. The clinic decided to make using the GPN system mandatory for all new patients starting on a certain date, the 1st of December 2021. This date wasn't chosen because of any patient-specific needs. But for practical reasons, this policy change created two groups, those treated before the mandate where using GPNs was optional, and those treated after where it was required. This mandate acted like a clue or an instrument. It helped them figure out the specific effect of using the GPNs on patients, separating it from other factors like whether a patient was just naturally motivated for therapy or if a therapist was particularly enthusiastic about the new system. They called the effect they were trying to measure the local average treatment effect, or LATE. This basically means the average effect of using the GPNs for those patients whose choice to use it was influenced by that policy change. What were they looking for? Two main things. First, how much people's symptom severity went down after therapy, measured by something called the Global Severity Index, or GSI, from the Brief Symptom Inventory. This is a common tool used to see how much distress someone is experiencing. Second, they looked at personality functioning, how well people were managing their core personality traits, using another scale called the Level of Personality Functioning scale. They figured that improvements in personality functioning might mean more lasting change from therapy. And what did they find? Drumroll please. Using the GPNS system made a difference. For symptom severity, the GPNs led to a significant reduction. The effect wasn't huge, but it was there, and it was consistent. This means that patients who used the GPNs generally had lower symptom scores after therapy compared to those who didn't. And for personality functioning, the impact was even more noticeable. The GPNs also led to a significant improvement in this area. What is really cool is that this improvement seemed to be even bigger for patients who started with more significant personality challenges. This suggests that the feedback system might be particularly helpful for those who need it the most. The researchers also checked that their instrument, the policy change, really did influence whether people use the GPNs, and it did, strongly. They also did some fancy sensitivity analyses, which are like stress tests for their findings, to see if their results would still hold up, even if there were some other hidden factors influencing things. And good news, the results were pretty robust. So what does this all mean in plain English? This study suggests that intentionally tracking patient progress with tools like the GPNs can actually lead to better outcomes in real-world therapy settings. It is not just about collecting data, it is about using that data to guide therapy. The researchers think that when therapists and patients look at this feedback together, it helps them make better decisions about how to adjust the treatment, leading to improvements in both symptom relief and how people function overall. Interestingly, they mention that while mandates are helpful, simply enforcing a system isn't enough. Therapists need to understand why it is beneficial. Communication and collaboration between researchers and therapists are key. Some qualitative studies they mentioned suggest that therapists sometimes underestimate the benefits of feedback, while patients often experience increased self-awareness and understanding. As for the stronger effect on personality functioning, they speculate that this might be because the feedback helps patients gain more insight into themselves, which is particularly valuable for those who struggle with self-knowledge. Now, no study is perfect, and the researchers are upfront about the limitations. First, this was a natural experiment, not a perfectly controlled randomized trial, so the findings might not apply everywhere. The group they studied was also mostly younger, educated outpatients, so more research is needed with different populations and in different settings. Like in patient care, they also mentioned that the sample size while decent could be larger for more precise results. But overall, the message is positive. This study provides solid evidence that systematically monitoring patient progress and using that feedback can genuinely improve the effectiveness of psychotherapy, especially in routine clinical settings. It is a step towards making therapy more personalized and ultimately more successful. What do you all think? Would having your therapist use a system like this make you feel more confident about your treatment? Let me know your thoughts in the comments below. And if you found this breakdown helpful, please give this video a thumbs up, subscribe to RUBIN'S Mind Lab for more science explained simply, and hit that notification bell so you don't miss our next deep dive. Thanks for watching.